Um, uh, Today, I'm glad to open this work session on the Anchorage Child Care and Early Education Fund, ACE Fund status update. We're on the record from 10:40 to 11:40. It's 10:44. We'll start with introductions. Mr. Solt.
Randy Solt.
Karen Bronga.
Zach Johnson.
Hannah Brawley.
Christopher Constant.
Meg Zelica.
On the phone, we have Mr. Myers.
Yes, thanks, sir.
Thanks. Any other members on the phone? Are you there, Ms. Quinn Davidson?
I'm here. Good morning.
Hi, good morning, Austin. And then over here on the side of the dais, introduce yourselves.
Hi, Trevor Storrs, and representing the board as chair.
Vice Chair Jessica Simonson.
Mildred Parker, board member.
Maya Liebersbach, Administration Manager at the Anchorage Health Department.
All right, in the audience, we have a handful of folks, including someone from the Department of Law, the Mayor's Office, other members of the board, so welcome. And if you feel like talking to other members of the board, there's room, so you can come on up if you want. So we have a presentation by the board, so I think we'll go ahead and dive right in to start the presentation.
Great. Well, good morning. And again, for the record, Trevor Storrs. I work for the Alaska Children's Trust. Been very honored to be put on the ACE board and was elected as chair. Austin Quinn Davison, who has been our contractor and support staff, is online. We'll be adding some pieces. I'll turn to her for some more specifics because she's been working on it. I do want to recognize you met a couple of the board members. You have other board members that are in the audience, and just want to recognize their service and thank them, as well as Nolan has been staffing us for some time, and just want to recognize from the administration and the other staff members that have been in support of this work. I won't go through the history. I think everybody knows how the ACE Fund was created. Do always just want to recognize the founders of that, which was actually myself and then Eric Croft, who launched it, and then it is turned into what we see before. And before the board came about, we had the implementation team that was putting together the initial budget and working things out as we were trying to figure out what the board would look like and so forth. So today we'll be focusing on just the past 6 to 7 months of when the board were first coming together, which was in about October. So our plan today is to just introduce the board, give you more specifics on who is on, discuss the implementation of the budget that you approved for 25, what is the status, discuss, many of you may know in the ordinance, there is the executive director position and how we're managing that moving forward, and then just touch on what to be expecting next. This group has been very, very busy, so hopefully you will get a lot out of today. So the board is made up of 9 seats. We had 8 members in October, and then the last member just joined us, who is Chuck over here. It's great. So we're fully have all seats filled. You see myself as chair. You met Jessica as vice chair, and then the other 7 members are listed. We meet monthly for 2 hours, and these terms are staggered. Some expire this year in October, others in 26 and 27, and then we'll be in a complete cycle with every 3 years terms ending. As I mentioned, we have just been meeting for about 6 months, maybe 7 now. What have we been doing? One of the key things is orientation. So the implementation team, many of you received copies of the report. Again, thank you to the Assembly and the Children's Trust actually put money forward to make sure that the implementation team was funded and being able to do the initial work. So again, thank you to the Assembly for that investment. So what we needed to do was also bring the board up to speed, not just of the work that's been done, but understanding the philosophies and actually also giving the same information that we did to the implementation team so decisions could be made. So really increasing people's expertise and knowledge around childcare and early childhood development. That has occurred. Also during this time, the 25 budget process, supporting the mayor's office of putting together the final budget, putting it before you, and then starting to figure out how do we get these dollars out the door. One of the things that we really wanted to do was learn from any of the challenges that have been faced by the alcohol tax over the years and how we might be able to prevent those same barriers or challenges. Always learn from our history. Worked with the administration on 3 primary funding programs, which I'll go into details here in a moment. We also began planning for the code required investment strategy in 26 budget. So within the ordinance, how are we going to invest these dollars? As in investment as a retirement, but what is our long range plan? So we are in the process of trying to identify a facilitator to work with us in developing what is a strategic plan for not just these funds, but we're also hoping to really look at, as a city, what do we need and want for childcare and early childhood development, and making sure that this fund is a part of it, but not all of it. And what does that look like? And then lastly, of course, we've been hosting the meetings to be able to do this work. We've been engaging with public and partners, responding to inquiries and producing communications. One of the things that the team prior to the implementation team, as well as this board, we really want to be transparent with the public. These are the public dollars. They have trusted us when they voted for this, that not only would we address this, but be open about how we're utilizing these funds. We see it as a key piece. So we've been really trying to communicate, whether it's op-eds, keeping the website updated, letting people know how they comment, and making sure that people are a part of the overall process.
Trevor, there's a question of whether you want questions now or at the end.
Questions now works great.
All right, Meg.
Thanks. So I appreciate the strategy piece to this. And I know you're the ACE Fund Board, but I'm wondering, are you going to be looking at policy recommendations as well? If there's policy or policy changes that could better help your investments? Just when it says investment strategy, sounds like the same thing like our trust fund board for the municipality might be doing. And I have the feeling with this expertise, the conversation doesn't end there.
Yes. Through the chair, yes. And really part of the strategic planning is this board is just getting familiar with each other and bringing everybody together and creating the space outside of our typical talking about, well, why not only have you joined, what do you want? What are you thinking? So investment isn't just about making money. It's really about how to use those dollars, to braid, but also to talk about, are we only just looking at this? Do we look at policy? So the childcare licensing has actually been starting to go through their own regs and looking at better aligning them with the state regs. And at our, not this April meeting, but our March meeting, they actually came and started sharing those and asking us for feedback. We really do want to see ourselves, both for the assembly, for the administration, as well as the community, is to be the experts to help guide this work. But that will definitely also include gaining information from local experts, because it's only a board of 9, and the community.
Thank you for that response. I think it's important to kind of start to frame that out. One of the things we really rely on boards and commissions for is your opinion when big changes might be coming. And so we will look forward to not just monetary recommendations then, but also potentially some policy. Thank you.
Highly encourage, if you are ever working on anything, if a comes to you with an idea, you're liking it, or you're not too sure what to do with it, direct them to us. That's one of the reasons why we will have a staff member to help be able to field that and connect. We make sure that public testimony is always at the beginning of our meetings, so nobody has to wait 2 hours, that it's immediate. At times we've actually made space because somebody showed up late. We see that as really important, guiding that work, as well as when you have people approaching you about money, the idea of us setting up a system is that now there's a process. So it's less about lobbying who you know, and it's about being part of the process and making sure we're following our strategic plan. All right. So what is things being,
Trevor,
Yes.
Karen has a question.
please?
Thank you. This is the right point because it's about your monthly meetings. Early on, I saw some notices that Austin Quinn Davidson was passing around about meetings, but I haven't seen an announcement in a really long time that I could share with someone. And I just wondered how you get out the information about your monthly meetings so that the public knows.
Sure. Austin, because you manage that, would you respond and I could add to it?
Sure, I'm happy to. Yeah, about till, can folks mute their microphones? Thank you. Through the chair, yeah, I would be happy to respond to that. I was planning to follow up today with an update on what we're doing and can definitely include the board on future calendar invites if you'd like for these meetings. As the contractor through sort of the summer fall, I was getting regular updates for the assembly, but I think that the administration preferred to give those updates starting around December. So I haven't done those myself, but I think I'm going to pick up that work here soon. So you should get more regular updates moving forward.
Thank you, Austin. And to share, we also try to connect with partners. For example, notification about dollars and when they're available. Austin has done a great job of reaching out to like Thread, the Children's Trust, other partners that have these contact lists going, will you please send this out? We've been also doing that as we are been putting together our 26 budget, letting people know when and how they can do testimony to give us feedback. So thank you. All right, 3 major programs. This was actually outlined in the budget that you approved. First is the early educator child care subsidies. I will talk about each one. Operational assistance stimulus funds for providers, and then pilot projects and capital grants. Each one of these that we've talked about, we want an application process to be accessible and equitable, and wanted funding to be available as quickly as possible. So that's one of the reasons why we actually started working on these as the board was even formulating. Austin was already on contract and actually starting to work going, how do we get these out, establishing a relationship with the Department of Health and grants and really moving this forward and not waiting. And it's working. So first is the early educator child care subsidies. This is 1.25 million. It was originally going to be higher, but recognizing the dollars couldn't get out and we wouldn't be able to spend all of it. So they dropped it down to 1.25, which made sense. Outreach to partners in designing of the program. We drafted the RFP, it's out, and the contractor will be working closely with the State Child Care Program Office to implement. Am I allowed to say who has that? Yes. So many of you probably know that this is going to the Alaska Family Services. Did I get that correct?
Yeah, I'll just add, it's gone forward to the
Oh,
assembly, so
yes.
it's public who we want to award to, but it hasn't been approved.
Approved.
quite
Thank
yet.
you. Thank you for that clarification. It was before you and you paused it because there was questions. Thank you for that reminder. So-
Mr. Salt has a question as
Yes,
well.
please.
Yeah, maybe more of a comment, and maybe it's more for Ms. Zalato. So we approved the single application process for the municipality. Would that also relate into entities as well, such as daycares?
Not yet, and
Okay.
it doesn't have to become effective until the fall was an effective date on that, but I think it's a great, and I see Mr. Falsey is in the audience. He can just take that note and back to the I team to think about that as we worked on that single screening for applications.
Which gets to my hope for that program, which becomes a My Alaska, My Anchorage type portal. Anyhow,
To raise salaries and not knowing much about childcare, despite having 4 kids. Is there a way to use the funds to maybe provide training or certification, assuming it's like other industries where the more certified I become, the more valuable I become, and also helps turn a job into a career?
Oh, great question. Yes, there is a process in the sense, and it's through the state system that you can get certifications. However, to pay more, you have to have more money coming in. And that's where the challenge is one, there's only so much of state dollars that are going to it. And there's only so much that they can charge families because they're already maxed out at that point. So yeah, you can get certifications and say you're going to pay more, but then where's the money coming from? And that actually also leads into going back to the original question is, if we put all 5 million towards increase in salaries, you can't then go, well, this year we're not going to do that. Dedicates the money and it really allows no other process of looking at the entire system. So the implementation team took a step back and went, all right, what are the other things that we could be doing? So one of them was, let's not decide how the money is increased. So one of the reasons we're giving direct money to providers is each provider is in a different environment. They have different needs. So they can use that money however they want. They could do it as bonuses. They could do to meet some equipment needs, which makes staff happy. Whatever that may be, it allows them that independence depending on where they're at and what their needs are. But the other thing is why were we increasing salaries? One, it was creating some retention, but also attraction. Well, what this does is both. One, there was a lot of staff that were talking about, I have my own kids. I can't even find childcare for them, so I can't work. Or can only show up to work a couple days and then they're not, things of that nature. So how do we create that, that stability? And then how do we retain them? Well, it's a great benefit. I'm getting free childcare. So we've seen, this was first done in Kentucky. They, when it was implemented, they had 17,000 kids served. Within 1 year, they were now serving 40,000 kids. And of that increase, only just over 3,000 related to this kind of subsidy. And the reason for that is I'm a childcare provider. I have one kid. Well, all right, that takes one slot, but there's 9 now more slots. So now we can serve more. So we saw a way of stabilizing the system, incentivizing one of the most important things, which was the need of staff. So that's where this came from. It's working in other states. Now, but as true as it is, other states are showing that it's worked, but we do want to evaluate. We have started looking at that process. I'm going to ask Austin. She's been leading, putting together the RFPs, working with the DOH, and working with the potential contractor when it gets approved on not just implementation, but how we evaluate. Because we've been really thinking about this, because we know not only you, but the public will want to know, what impact is this having? And as a board, we want to know, because do we continue this or do we need to pivot? Austin?
Sure. Thank you. Through the chair. We've kind of touched on some of this, but just some foundational info that I think is useful. If you work in this field, if your family works in this field, you're twice as likely to live in poverty, and the average worker makes about $30,000 a year. So just to sort of put in the frame, the sector.
Austin, your phone is cutting out.
Can you hear me?
Now we can.
Weird. I'm sorry about that. Anyway, it's really a transitional time. I mean, I think those of us who were on the body and around COVID times remember really seeing all these struggles in childcare. Well, it turns out that was already happening before. But really, this gave us an opportunity to look at how to make structural changes. Anyway, this program started in Kentucky in 2022. As Trevor shared, there was a lot of evidence that it was working. How will we make sure it works here? One of the challenges is that this sector is very data poor, and that isn't just here, it's in other places too. But one thing we've been working with, me and the implementation committee of the board, with the potential contractor, and even thinking about it prior to the contractor coming on, is how do we collect data that are appropriate to form a baseline foundation for us to then understand where we see improvement. I think we would look at improvement and success of the program by looking at the state of the workforce before and after the program is established, whether longevity of the workforce increased over time, because the whole point of this is retention and longevity, right? That then assures more spaces, not only for that worker, for their kids, but for the community. And so we want to look at longevity, and we want to look at whether more children have access to programs before and after this program started. So those are the things we've been talking about. There's a lot of data to collect to be able to do that well, and that is part of what the RFP asked for. And I think, just to be honest, I think it's unlikely, right, that starting this program up now for the remainder of 2025, that will allow us to collect enough data and evaluate the program well. I think the program might need to run a little longer than that, but I shouldn't speak for the board, and we haven't talked about the 2026 budget yet, but just throwing that out there. Thank you.
All right, I have a question then, Meg. So I asked this question the other day, and I didn't see it in the draft documents presented to us. What protections are in place to ensure that Alaska Family Services is making grants in Anchorage and not in Wasilla or Palmer, or where their focal point is for their general business?
Right. So, and Tamaya and Austin can also probably add to this. So one, it's very much going to be outlined in the contract and so forth that it's MOA only, and that the services are here, that they have a reporting mechanism to be reimbursed. They're going to be providing, and the whole system will be reimbursing, I believe, the provider, not the individual. So the provider has to confirm, we know that the provider is here in Anchorage and providing that service. Now, and so we're going to make sure there's that loop in that process to make sure. Tamaya, do you want to add to that, please?
Yeah, happy to. So first, this program actually isn't a grant program. It's providing childcare assistance, essentially, to individuals who work in the childcare sector. So it's really kind of an individual assistance program, but like the state childcare assistance program works, the Alaska Family Services will be paying the provider where those kids are getting their services. So we have a couple of things in the contract. One is that in terms of eligibility requirements, when people are applying for that assistance, is that they have to show that they're working and residing in the municipality. And then another piece that we put in with Alaska Family Services, because we knew that their main office is in the Mat-Su, is that any direct services they're providing, so having people come into the office to help with applications, that sort of thing, they have to provide at their Anchorage office. So their administrative work, that sort of thing, might happen out in the Mat-Su, but all of the direct services and the actual childcare assistance is staying within the municipality.
So of the 1.25 million, what is allowed on the administrative side?
Yes, so I know that was in the AM. Let me pull up their budget. So they have indirect, sorry. Let me tell you how much is going out the door instead. So total subsidies going out will be just over $1,027,000. And so then the other costs are their personnel, outreach, advertising, those sorts of services. So some of those overhead services will be direct services in the municipality. Some of them will be, services potentially out of their Mat-Su office, but also advertising the program, setting up the website, all of those kinds of things.
So it's essentially about 20%.
Yeah, it's right around that.
Okay, thank you. You had a question?
I think
Meg? Oh, go ahead, Austin.
Can I add something to that? Is that okay? I think it was about maybe 17 or 18%. We actually worked to reduce it. Tamaya and Jessica and I met with them and talked with them to try to get that number down. I just wanted to note that this program, compared to the stimulus or operational grants program, is much more complicated. Which folks am I muting? I'm sorry, it's so hard to talk. You know how that goes. This program really, mostly these programs are done at a statewide level, right? So in Kentucky, this folks who work in the sector, their children are eligible via the fact that they just work in the sector throughout the state. Here it's a little different because we really need to partner with the state who has an up and running assistance program to do this specific program only for Anchorage workers and kids who are using Anchorage services. And so it's just a little tricky, and having the organization that runs for many regions in Alaska, runs the state assistance program, is of great benefit to us because they understand how that works. They can, for ease, we want these processes to be equitable and accessible. And I think it's easier to do that if you have someone who knows how the state system works, because then there can be efficiencies there and, reducing bureaucratic barriers for folks, et cetera. But it is going to be more complicated. Folks who are familiar with the state care assistance program, there's a massive chart with many different co-pays that folks have to pay if they're eligible for assistance. How do we pair the muni dollars, of course, for Anchorage people to those co-pays? Do we meet the cost of care or just the rate that the state reimburses for assistance? There's so many things to consider that it's going to be a bit complicated to get up and running. And I think that higher administrative cost shows the level of involvement of sort of higher level people at Alaska Family Services helping us to create that policy in a way that makes sense.
Right. Thank you, Meg.
Yeah, a couple of things on this. One, I am sure we got Austin's white paper. We also get hundreds of emails. So if that could be submitted by AIM, and then if you are referring to a particular strategy in that white paper, if you refer to it, we can then look through our portal and bring all of those things up. So it's way easier than searching thousands of emails. So
Yes.
as we all work on our process improvements to get on the same page. I'm looking at Title VII. We have to have the essential terms of the contract. Technically, what we have before us meets that, but I think we need to really, and we're going to be talking about Title VII here shortly, and it's hard, right? A board making recommendations, and now you're in the municipal process. I get that. But if we are ever contracting with an entity where its main offices is located outside of Anchorage, just a reassurance in the AM that yes, it's going to serve Anchorage residents. If there's an overhead amount, maybe we could start calling that out, because I think particularly when we're starting to use a new tool, and this is a bit of a new tool where we're doing more of a lump sum grant for programmatic administration, I think we need to put that kind of information in front of the assembly, either through the board's recommendation, but actually maybe more importantly for Tamaya, through the lens of the contract administrator, and making sure that that's happening. I think it's cool we're using a new tool, but these are the things we look for when we read these documents. We want to kind of make sure we just kind of can check our own mental boxes that everything's in line. So thank you.
And just to share, Alaska Family Services, they have an Anchorage office, but they were also, one of the things that stood out is they actually work with the state and are responsible for the Anchorage childcare subsidy program. So they already do this work for the state that can only serve Anchorage already. So that's one of the reasons they stood out, is they already have a system in place to make sure it meets exactly what you're talking about. And then on the administration side, when we talk about that 17%, there's the money that's going out for the subsidies, but we know you just can't have money for subsidies without staff time directly related to managing that. That's not administration, as well as the advertising to let people know this is available and implementing that. The administration is like the insurance, the financial. So when you take that piece out, really the administration is much more around that 10%, which is that normal allowable amount, because there's always going to be a cost to also get the subsidies out the door, program related.
Yeah, thanks for that additional explanation, Trevor. I think, as I read this memo, though, it doesn't say it's only going to be, and it didn't say this thing about them administering the other program. So I think we just have a little bit of lack of information. For me, really, I think where I had pause is it says the contractor will design an application process, establish eligibility standards, review and analyze out. It's going to do all of these things, and it's possibly a 4-year contract or a 5-year contract with renewal options. And we don't have any visibility into what those things will be. We never see the final contract. And so I think really understanding the aim and where we're trying and getting when these things are established, I think what will be really essential to getting the additional options approved, or the money to approve the additional options, will be making sure that that information makes it back to us. Thanks.
Just a coda to that it literally says the contractor will be responsible for designing and implementing eligibility. It doesn't say we have eligibility requirements that include or any minimum base. And so what we appear to be approving is a blank check for the contractor to set eligibility. And so that is a real concern for those of us who've been kind of down these roads before.
If I could just say something really quickly, it says the contractor will be responsible with direction from the ACE Fund board, the existing ACE Fund contractor, and other municipal staff. So yes, we don't have all of the eligibility laid out yet because it's a brand new program. And so the contractor will be designing that with the municipality directing them and approving it is what we communicated here, just to lay that out.
Past experience, it was not unsurprising to see, just let's go to snow plowing, snowy day, that ARDSA money was being used to plow LRSA areas, even though the law is very clear that you cannot use ARDSA money to clear LRSA areas. And then there was never any audit or check back or payback. So we, the lowlanders, ended up paying for snow management because the terms came to us in a generic way. And so our concerns are for fidelity and understanding what we're approving. And when we have an independent board working on all of these things, then it becomes a conversation between the administration and the board. And we're just, give us the money, please. And we promise we're going to do it right. And then who knows? And so that's the concern that I think in establishing these kind of third-party entities responsible for expending or proposing at least, and then authorizing contracts or drafting contracts for the expenditure of substantial sums of public money, that we then were just the checkbox along the way to getting the job done. And it is really not tenable for us to be in that position from our experience.
Yeah, just to put an idea on the table,
Mr. Chair,
maybe.
can I, oh, sorry.
Oh, yeah, just briefly, a couple ideas would be setting a policy essentially. Maybe there is a broad policy that the board would adopt or we would adopt by resolution or something. There's some mechanism to do that would put some of those things in place. If there is a third party, these are the baseline conditions and those should be built into the contracts, but maybe that could be elevated above. That's just something that we could work on in the future.
Near future.
And all this, I really appreciate this feedback. This really comes down to something even the board's been talking about, and it's kind of brought up at the beginning, is how do we communicate? What do you need? Just so you know, we never thought any of this was like, a checkbox, and that you would all just blindly. And I would never want, as a voting member in this city, want my assembly to ever do that. So your feedback is helping us figure out exactly what do we need to be making sure that you have, so you can be making decisions and know what we're doing in that communication process. So I know Austin, everybody's taking great notes and will be incorporated into our overall communications.
Austin?
I think Trevor covered it. Sounds great.
Yeah,
Thank you.
okay, thanks. And again, it's really mostly, these would be classified as growing pains.
Oh, yeah.
Yeah, this is just classic, like. this
We're
is not
6 months.
Unusual. Yeah, and
We're their early childhood.
We're just very, very cautious
Yeah.
anymore. We have had to learn the hard way. So,
No, and that's great feedback. We're all learning. And I think it's great that board members are here seeing it as well, because we're reviewing these things and how best to approach this. So hopefully when it comes to you all, in a sense, the box are being checked, what you're looking for, and it makes the process easier and the dollars out, and it minimizes all the frustration and so forth. So really do appreciate it.
So, Bill, since you're in the room, and Anna's proposal just now, to look at these kind of quasi-governmental boards that have this proposing authority, that might be a whole subsection of Title VII that we just put some framing around how these processes are intending to work. Probably not in depth and detail. We don't want to constrain too tightly, but just to put some structure in there. And I don't know what we would even call these, but they're starting to become more common. And so Since we have this Title VII coming through, it might be something we could address simply in a process that's coming forward. Trevor.
Thank you. We'll go on to the next project within this funding. It's operational assistance at 2.4 million. These dollars are going to the contractor at Thread. They did a great application. They were selected. They've done this work for the state. And actually, I think even did some money, same process for the Muni during COVID and COVID dollars. They are well established to be able to do this and handle it. So they were selected. And again, we are designing, again, figuring out and utilizing their expertise, not just of their past experience of doing this, which will be valuable, but also as being the lead supporter of childcare programs. They also have that insight. So it's working with that expertise, putting this together and getting money out the door to those specific programs, which allows them to utilize it. There will be a framework that they have to, it's just not willy-nilly in that sense. That is my professional term. And being able to use those dollars, how they see will best help them, again, stabilize themselves, as well as support their staff and hopefully at least be able to keep serving the kids that they have, and or maybe potentially, wouldn't it be nice if they could expand? Tamaya, do you have anything to add?
So I have a question on this, and similar to the previous question, you had talked, and I think it's a smart decision about not going too big, not to create yourselves as being a permanent fixture in the funding mix until you understand the kind of relative value and where your best investment could go. So are you having the same conversation with these folks that this is a preliminary program? We're still testing everything, and please don't get yourself to the position where you believe this is your permanent operational money.
Yes. Everybody knows it's not multi-year. It's 1 year, same as we all apply. And then we'll be seeing, and again, our strategic planning will also help decide. But again, the implementation team was like, what's the things, and just trying to get these dollars out. We started this in October. When you work with as a grant maker, I can get money out within about a month, at the most 2 months. The bureaucracy doesn't allow for that, and for very specific reasons. So we're like, oh, what's the quickest and easiest, and especially for what's needed for stabilization, as we figure out what are the other things that are needed.
All right, Zach.
Yeah, thank you. So looking at these three programs, how much overlap is there, right, in terms of which providers are able to tap into these? Because I understand they're sort of going to different, different, I don't know quite how to frame it, but sort of like targeted differently. But when I kind of think about this space, I mean, if I am a childcare provider, am I able to take advantage of each of these three?
Yes.
So to speak?
Yes, they can. Yeah. I always look because want to make sure I wasn't in the full design. Tamaya has been, just for the record, which I've been doing constantly, Tamaya has been outstanding where we are today and as quick as we are because of the phenomenal work. And she's really looked at and making sure that we're applying not just the municipality regulations and requirements, but thinking about the things that you were just asking. So please comment.
Yeah, I can add to that. So certainly the operational assistance and the pilot project or capital funding, I imagine there will be, some overlap between who we end up giving grants to under that RFGP that's still out and who might apply through Thread and get the operational assistance. There also will be overlap in terms of those early educator childcare subsidies because they're going to the childcare entities where people have their kids in place. But they're all sort of targeting slightly different needs of the sector overall, if that makes sense.
It does make sense, yeah, and I don't necessarily see a problem with it, right? But I would guess if we're trying to, further down the road, think about metrics we use to measure efficacy and sort of a bang for buck, recognizing that if there's a provider that's taking advantage of all three programs and sort of what is the value proposition of that versus some who might be, or potentially doing more with less.
Well, and we're also trying a little bit of each thing so we can actually see what does work. And one of the things we want to hear from providers is what was most effective to them. And And again, as we move things forward and being effective and efficient.
Great, thank you.
So I have a question, and I don't want it to signal opposition to the approach.
I'm
but I-
ready for you.
Yeah, it's the question of how we have a grant in the budget that's already proposed to go out if we're still in this kind of analysis phase, and the kind of pre-expenditures, and that grant specifically is for a childcare center in Girdwood. How is this operating in the context of this effort, and what's the rationale here?
Well, I appreciate that. I can't respond. That was an amendment made by the administration. The administration will need to come forward. I will speak as the chair. They know that we have the capital grant process, and I have already posed to the administration the question of why is this being done outside of that process, and what conflict does that create by doing so? I can't answer any of those questions, and I'm not sure if the administration is ready to answer that, but I need to turn to them.
Someone want to tackle that question for us? Again, I don't want to signal opposition. The conversation is coming before us properly, but I definitely want to understand mechanics.
Happy to assist. Bill Falsey, Chief Administrative Officer. I think that we see this very similarly, that going forward, there would be this competitive request for grant proposals type process, and the board is sensibly trying to rack up a process where people apply under some standardized criteria and make awards that are well justified. In this case, the Little Bears Playhouse in Girdwood has had a capital need that has been noted by the community and unfulfilled for a very long time. We also heard some requests from assembly members to find a way to fund that sooner rather than later. The administration agreed to that in part because it was our sense that Little Bears Playhouse would rise to the top in any RFP type process. Certainly that is one that we can discuss as we move through first quarter budget revisions.
So then let me kind of try to summarize that. The theory is there's a current and present capital need. The process of the board developing its protocols is in development. And so it's the determination of the administration through the Q1 process to propose to the assembly to just do this one because it's a need that is impending and real. And
I think that's right. And I think this would be a sort of one-time early edge effect. And in some ways, in my mind, from municipal history, it sort of reminds me of the life safety access road process, where we said we want to create a real process where we can surface the highest and best uses of acute community needs for life safety access roads. But we know that mountain air will be in the first batch no matter what. So that one went while the process ended up lagging. Here, the process is not going to lag.
so I would offer that maybe there is actually some space to work with the board to create a reserve portion that, whether it be the administration or the assembly or a collective decision, we can triage specific projects. Because in the end, these are recommendations, right? The process you have ultimately comes to the assembly for appropriation, but it might be smart then to think about some process that allows for this in your mechanics so that it is not a shock. It is kind of anticipated. So maybe there is something there.
And I do think that we will get better as we go. As the chair of the board mentioned, we are 6 months old now. So as we're learning to walk and talk, I think we're going to talk and walk more effectively in the coming months. So there'll be fewer surprises, better coordination, and hopefully this is a one-time thing.
I do love the idea of some flexibility, but it should be done in coordination. Anna?
Yeah, I think a couple points to be clear about, and then this will go into a question. I'm glad we brought up first quarter budget revisions. First, there was a year of money before this board existed that was being put in this fund. So 2024 is when the money was dedicated. And so basically there was an extra, well, I want to say extra, about 5 million more or less, that is not part of the, you know, if we get 5 million a year, it's an extra 5 million that wasn't necessarily built into all of this kind of continuing forward. So I think one answer is there is that pot of one-time money. Not that this is the way we should use all of that, but we should just be clear that we're talking about not over committing the fund, but there was that extra money. And I don't know how that plays with what we've already, or what, you know, there's already been appropriated. But also I think during first quarter budget revisions, I think it would be helpful, maybe more from the administration than the board, because I looked, your next meeting is until May. I think partly what's also coming up is the practice of, especially in alcohol tax, having directed grants that are assembly amendments for the most part, not always, and are basically those one-off decisions that are not part of they're a political process. And so that's where that came from. That's also where I believe the Mountain View or the Boys and Girls Club funding, I think, is also in the ACE fund at this point, if I remember correctly, because that was where we decided the money should come from. So just to say that's been a practice, it continues to be a practice. It is part of our budget, so it's not something that we would stop doing. But the goal is to, I think, transition this fund in particular away from that practice to the extent possible, or at least having a justification for why we would still do these one-off directed grants. But just to say that as well, that I don't know how much fund balance there is. But anyway, so my question is, I think, to the administration or to the executive director of the ACE fund, acting contractor, is what direction or what recommendation would you make for first quarter? Because we are about to come into that in the next week. And so should we leave the money there? Should members consider that as fair game to make amendments? I mean, again, I know we have the right to do that, but I think it's worth thinking about strategically, because otherwise what will end up happening is any extra money will start going into directed grants unless there's some discussion otherwise.
Meg?
Yeah, and so the timing of that request, I think I heard from Ms. Brawley, is we will be taking up first quarter budget amendments next Friday. So if the board has particular advice for us, getting that next week before we take up our amendment process would probably be the best timing. So just wanted to give you it's a fast time scale, I realize, but that's the trajectory we're on right now.
But also be very mindful that next week is the later in the week, the harder it gets for us to consume information.
We're
as we get
used to
closer
fast schedules.
Tuesday. So, there was also a question raised similarly to the Little Bears about the MOOB Center and if that was part of the conversations, if that ever rose up. And I know that HMOOB, I think it's the Hmong Childcare Organization. And so I think they were in a similar critical situation, but maybe more along the lines of if they don't have money, they will cease. And so I don't know if the board has also thought about having a crisis fund portion, right? A reserve that would be allowed for making recommendations on an annualized basis to stop bleeding, to stand up, to fill a gap. I don't know. So just something along those lines, as opposed to programming 100%, having a protected pool.
So that's why we have the board here. They're going to be coming together and not only figuring out the 26 budget, but also the long range. So we can definitely add that and really appreciate that perspective in that sense. In the sense of communication, just so folks know, most of the 5 million that was collected in the first year has actually been spent, just so you know. We took money out of the alcohol and paid through this 2 million to ASD rather than using alcohol. There was a lot of use of those funds. We did get an update on the fund. Bill might be able to share a little bit more, but most of that money is done. Just being aware of. Our hope in the sense of communication and around the Little Bears, the mayor will be joining us in May. We are setting up that part of the communication process is to make sure that the mayor meets with the board a minimum of once annually, especially before we plan our budget. Like, what are you thinking? We want to work in concert with things of that nature. So these types of things aren't popping up and catching us off guard. But as we talked about at the beginning is, what is the role of this board? Utilize us. Someone's coming in going, hey, we would like. Well, how does this relate to the current plan and processes? Like when this decision was made, the RFP was actually in process and might have just been laid down. Little Bears could go through this. Decisions, applications due by the 15th of May. They would still get the money the same. There's other programs that have been greatly vetted and needs these funds. I don't know how as a chair, and this is where this administration is really going to have to step forward, is if somebody asks me, why did Little Bears have to go outside of the process and get the money? Why can't we? And how do I tell them, no, you need to follow the process? These are the conversations. And that's what we really encourage. And I think that's part of the overall communications aspect of making sure those links are there so people aren't circumventing the system.
Yeah, I think that the reality is appropriators are always going to have some part of that role, and advocates can advocate. And I don't think that we are, and maybe should be bound by strict compliance with the procedure, but generally I think it's good, and communication is valuable. And I would correct one thing you said: if they went through the process, you can't say they will be funded. You said they could. And so
I can't guarantee money.
yeah, that's right. So you use the word will, and I think that can't be asserted. If you're going through a competitive process, may would be, or could would be the answer. Okay, do we have more? We have more slides?
A little bit. I'm going to go quick just because of timing and so forth. The next aspect is pilot projects and capital funding, 2 million. There isn't a split. It's not 1 million, 1 million. We see what proposals come in. Pilot projects are going to be tough. I think one of the biggest things I will recommend and advocate as a person that has applied for your grants, got money out as well in this position, is you keep butting up to December. All money spent or it comes back. You can't give a grant that starts in July and ends in June in your current process. So pilot projects are probably going to be challenged, because how do you pilot something if the money could even get out in 6 months? That's our goal. So it might be more in the heavy set of capital funding. But we don't know. We'll see. And again, one of the things that the board is looking at and is encouraging is kind of use us as like the alcohol tax is like, okay, what systems need to be in place to really support and getting not just the money out, but really support the vendors or the contractors to be able to effectively do the work.
Trevor, we are running out of time,
Yeah.
but I do question why then we don't time the process so that it doesn't conclude in July, but instead concludes in December, right? And so, like, I don't understand why we don't set up grant application processes in the prior year so that they are finalized and formalized and become effective on
Yes.
January 1. I just don't get it.
Well, we're going to let go ahead and answer, and then we're just going to run through this because that's probably
Yeah.
a bigger question.
I can speak to that really quickly. So that is what we try to do. This, because the fund was brand new, we had no idea what money was going to get put into what buckets. And honestly, there's no municipal staff for this currently. That's why we're in the situation we are. I have been doing this on top of my job. And so, we tried to get the other 2 pots of money out first, and then we focused on this one. But if we know, okay, this is probably going to be in the budget next year, we'll have an RFGP ready to go. Once the budget passes, then we can put it out with the goal of having awards ready to start on January 1st. So that's our goal. The budget process and timing sometimes makes it difficult, especially with brand new budgets.
Yeah, and I think that the board should really push for a conclusion of the process by December in January. And obviously, starting times are one thing, but it is just exhausting to have a grantee get an award in September and be told by January 1, you got to spend this money, setting people up for failure. And so let us not set people up for failure.
Well, and appreciate that. And I absolutely agree. When I shared about some of these challenges, I hope nobody is taking it that it is slight to any of the administration and or the great work that is happening. It's just identifying what they are and how do we work beyond them. Again, for the record, Tamaya has been exceptional in this, and DOH all have been just great in supporting us through this and working rapidly.
Yeah, I don't want anything
Yeah.
I'm saying to be interpreted as a slight
Good.
to anybody. These are questions to
Yeah.
improve the process.
Yeah.
Next slide.
Cool. Lastly is the executive director position. You can read through the slides. So the board started exploring, looking. What we're actually going to do is an interim executive director. It's we're working on an approach. Hopefully I'm not misstepping, but we are doing a contract and which will be coming to you all. I'm hoping it's maybe on the docket. Yeah. Okay. Thank you, Bill. Thank you to Bill. He's been really on top of this and helping us get this through, which you will all then see, which would be extending a contract to Austin to keep 12 months going and be interim and not just a contractor, but seen as the executive director. Reason we're doing this is one, the work that's being done, she's the content expert, knows it. We try to bring somebody in. It's actually going to slow it down and will actually prevent us from even getting some of these funds out. There's a lot more work that needs to be done before we just bring somebody on. And she has that background to be able to lead us for the next 12 months. And we will be, as a board, after the strategic plan, starting to look at, okay, what do we need for the executive director? We'll be in a better position to bring on somebody permanent. So it's again, kind of the building the plane as we fly it. And what's next is us working on a strategic plan, the 26 budget, all those things we've talked about. And also just looking at how do we use these dollars to leverage more dollars in investment in the work, not that we're doing, but our city is doing around childcare and early childhood development. And I will end there.
I would offer, please consider in your strategic planning process, ensuring there are checkpoints with the assembly.
Yes, communications will definitely be a part. And again, these are some of the things we're working out with administration because we don't want to step over or on and trying to figure out what those are. And Bill has been very helpful in figuring those things out and giving us the guidance. So again, just want to appreciate the support that the administration has been providing.
I want to be clear though, I wasn't just talking about sending us flat documents that say this is what we've done. I'm talking about being involved at some checkpoints in the strategic conversations.
Oh, thank you. Appreciate that. Will do.
Yeah, and I know we're over time. Just to briefly add too, I think it'd be really helpful, whoever not that the facilitator would be the one to know this, but just to say, whatever process you go through, I think it would be helpful for the board to have a general briefing, not on our entire budget, but some of these key mechanisms that we talked about, what our fiscal year is, because I think I've been involved on both sides of processes where there isn't that understanding or there isn't that conversation. And so that's where some of the divergence happens. And then it comes back and it's just harder to deal with. So I think that would be really helpful because you guys are operating within, so I'm looking at Bill and folks like that, within the space of this government and the structures we have. So I think that would be helpful. Yeah.
I mean, if you look at the separation of powers.
May I add just one? Oh, I'm sorry.
Yeah, if you look at this, I'll get you 1 second, then we got to finish. But if you look at the separation of powers, we are the appropriators and we set the direction, the strategic direction of these kind of things. And so the administration executes, and of course they're a partner. They propose, we shape. And so just remember that's the role that we're at, and we want to be in these strategic conversations because it's our essential function. Austin, to take us out.
Yeah, just quickly, thank you. I'll get you all on the calendar invites for our meetings in case you ever want to attend. Member Perez Verdia attended, and it was really helpful and gave us a space to talk about communication with the Assembly, and this work session came out of that. So thanks to him for doing that. We have discussed doing quarterly updates at the, what you call it now, I think, Public Health and Safety Committee. So we'll be planning to do that, not just updates, but an opportunity to hear from you guys. And we've also talked about how to engage the Assembly and the administration in the strategic planning process, whether that's you being there with us while we're doing it, because we realize this is a municipal program. It's not just a board program. It's bigger than that. So thank you.
Thanks. And my hope with all of that is that we never find ourselves in the dark days where you have an administration hiding the ball from the Assembly and then handing us the package and saying, you do what we tell you, and then bad things happening. And so the goal is reverse that flow. Everybody be upfront. Let's have these conversations openly and let's meet the needs of the municipality. So thank you for this work. And with that, we'll be adjourned. We're going to convene back at 55 after for our next work session.
Thank you. Yeah, a lot of work has been great. 6 months. Like a lot. Yeah. No, and you're doing